Full-service real estate firm saving you thousands of dollars selling your home.
So happy to have Dr. Jes Dwyer on the show this morning with Acu Chatt. Good to see you.
You too.
I feel very honored actually to have you here because you were telling me people are clamoring to get in with you. You're very busy.
Yes, we're about 1 to 2 months out at any given time. We do try to move people up if there's a last minute cancellation, but unfortunately it's not fast to get in.
I was asking you off camera if you're seeing any kind of trends in who your typical patients are, because it feels like over the last, I don't know, maybe 5, even 10 years, people have come to really look to acupuncture for so many reasons.
Yeah, it's actually becoming more popular as a first line of treatment for a lot of different things. So especially in an injury, the faster I see someone, the better it is long term. The faster you see results, the better your recovery is, that kind of thing. But even for internal medicine, so like digestive issues or poor sleep, hormone issues, all of that, we're seeing a better improvement in people getting away from medications. I
mean, a lot of people for years have associated it with fertility concerns. You see a lot of that in the office.
Yeah, I'd say about 30% of our patient base is fertility. We actually had a patient, she had a difficult journey, but it took her 2 years to successfully carry a pregnancy, and she just brought her 2-month-old baby into our office and put him on the baby wall. It was very exciting.
You know, you told me something once that's kind of, I think, a special designation for you personally, because you spent some time kind of apprenticing, if you will, studying under some very impressive people.
I have. I was a bit of a super nerd, so I did some extra stuff. I worked with a Chinese doctor for 2.5 years in his clinic. I got to go to 301 Hospital in Beijing, China, which is essentially their Johns Hopkins, and do acupuncture in the hospital there and work with a specialty practitioner for medical-based acupuncture. I also worked with an herbal specialist for over a year, and I did a sports medicine training in Florida for over a year.
So when people are coming to you, they're getting like this highly personalized touch, right? You're customizing it to each person who comes through the door. On the herbs, for example, you sell them there at the office, but not everybody will need the same thing.
Correct. So all of Chinese medicine, it's very specific to each individual case because we're looking at minute details to make the pattern. So if you're looking at like colds and flus, for example, we break them down past a cold and flu. So you can have what's called a wind cold, which is just kind of like a scratchy throat. You can have a wind heat cold, which gives you a fever. The cold type of cold will give you more body aches. So which one of those you have determines which herbs you get.
And why would that be that people would experience a cold in such different ways?
Different viruses, if you're looking at modern science, are going to cause different reactions in your system. So how your body's fighting it is going to show up differently. But you want to use the correct type of medicine for which way it's showing up in your body.
So this is something, can it be used as a preventive? Or?
It can. So we have a couple different formulas. The most popular one is yin chow. So if you take that within the first 24 hours of a cold, you're likely going to stop from having the cold altogether, or maybe just have a very mild version. Then after that first 24 hours, if you get the sore throat and fever, you're going to keep taking that, but if you start to get the body aches, you're going to switch to a different formula.
Okay, the fact that you are kind of 1 to 2 months out in appointment times. Spring will be here before we know it. We all want to enjoy the season, but if you're an allergy sufferer, you're thinking ahead to that. You do a lot of work with allergists.
We do. I did a year studying for SAT acupuncture, which is the ear allergy treatment. It's a one and done treatment for each individual allergen. Unfortunately, Chattanooga has the most allergies of anywhere in the US, so it takes a few rounds to get all of the different seasonal allergies that exist taken care of. But once you do, then you should be good indefinitely.
So, okay, we'll talk seasonal allergies for a minute. If somebody's done the testing, which you will do your own testing.
Yes, ours is more minute than you will get as a scratch test. So they're looking at categories where we're looking at each individual strain.
So let's say someone's allergic to mold. Then you're going to break it down to see what the different types of mold are.
We look at about 15 different molds when we treat mold.
Okay, so in that scenario, then when they come to you, are you able to treat all? If they were allergic to all 15, you pick the ones they're most allergic to?
I recommend treating any that turn up positive, because if you don't, the ones that are mildly positive are eventually going to become more positive since they're not fighting other molds.
Okay.
Right, so if it's positive, we treat it. If it's negative, we don't worry about it.
So I think it's important to stress to people what you just said, that you have to sometimes do repetitive treatments. It's not because the first treatment didn't it's that you're allergic to other things that couldn't be targeted.
Right, so like if you look at trees, for example, there are 55 common trees that induce allergies in Chattanooga. So the first treatment, we might get the first 15 of the trees that someone's allergic to, but then they might have 15 more that we need to treat. So it's multiple visits, but it's one treatment per allergen.
Are people afraid because they think the needles are going to be bothersome?
Sometimes we get that. It's pretty known at this point that it's not as uncomfortable. Most people only feel it for the first 24 hours. And it's more like, oh, I need to itch my ear rather than pain. So some people are afraid, but most people understand that's kind of the case.
We watched you do it on the air. I know 2 people personally who've done it, but it goes right in the upper part of your ear.
It's the conch of your ear, so it's down this part, and it's on the It's not in your ear canal, but it's on the outside of your ear right here.
Okay, very, very tiny.
Yes, the needles are 3 millimeters.
You can still shower, live your life.
Yes.
Don't go swimming, maybe.
Right, you don't want to submerge your head, and we give you like an ear shower cap for your ear to keep it dry and help in the shower. But honestly, I always forget to wear that, and it's fine.
Can you sleep on that side?
I do, yeah.
Okay, so it doesn't matter whether you do right ear or left ear, or does it?
It has to be right ear for the allergies.
Really?
Yes, there are some other treatments I can do that can be either ear, but the allergies specifically do better in the right ear.
Okay, I know you have afternoon and morning appointments,
We do, yes. So I see patients in the mornings, and then I'll do 1 afternoon a month to cover allergy treatments. And we have our new acupuncturist, Summer, who's been with me for about a year now, but she's doing afternoon patients, so that's really exciting for us.
If there is a fertility issue, back to that, is it important, I guess, that you know that it is whichever respective partner who has the fertility issue? Because she says, well, you sometimes
male or
treat
female,
men and sometimes treat women,
Yes, we typically see the women, but we always ask about what's going on with the men, and if they're having an issue, we recommend treatment with them as well.
Okay.
Ultimately, the best chance is to treat both partners because we're going to enhance both opportunities.
Okay. And I'm curious too, you mentioned the sports injuries.
Yes.
There are a lot of people who play a sport, and then if you're like a senior in high school, you want that scholarship money to come with your success on the field. So if they have a sports injury, they can come to you and you can help them?
Absolutely, yes.
Okay. All that in one 7-minute conversation. Acu Chatt, Dr. Jes Dwyer. Check out her newest acupuncturist, Summer. AcuChat.com is where you go online to make your appointment. And if you are interested in allergy testing, you designate that.
Yes.
It's a different type of an appointment.
Correct.
Great to see you.
You too.
Get ready for freezing season. Local 3 welcomes